Hey everyone, welcome back to all my listeners. This is episode number 17 of season 9. Today is Wednesday, August 23rd, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, let's go ahead and get right into the day. Today's Newsworthy update involves the latest cybersecurity alert that's been put up by the Joint Commission. And in my compliance tips and in my compliance recommendations today in Trusty Tip, I'm going to go ahead and get into the new updates that are starting January 1, 2024 for acupuncture. And of course, I go ahead and end the day, I round it out in today's Spark with a remarkable quote on success by Confucius. Now, if you guys have checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and our valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations or to dive in deeper to use my tips and my best practices to ensure success. I hope this podcast will help you guys boost the quality of documentation capture and improve your coding accuracy as you help all your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts, and definitely do start following this podcast on Spotify or wherever you find this podcast. Amazon Music, Google Podcasts, wherever. It's everywhere. Now, as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my compliance recommendations based on my over 13 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into Newsworthy. Now, this is Sentinel Event Alert number 67 that was developed from the Joint Commission, and it's titled Preserving Patient Safety After a Cyber Attack. Now, I think this is a wonderful alert and very much needed piece that all healthcare leadership need to read and utilize to help them not only address the attacks by how to react to them, but also how to better prepare for them. Now, the number of cyber attacks and information system breaches in healthcare has grown steadily over the years, escalating from isolated incidents to widespread targeted and malicious attacks. Now, in 2022 alone, there were 707 data breaches that occurred, exposing more than 51.9 million patient records, according to data released from the Department of Health and Human Services. Now, to help healthcare organizations address this growing patient safety concern, the Joint Commission issued this Sentinel Event Alert number 67 that focuses on risks associated with cyber attacks and provides recommendations on how healthcare organizations can prepare to deliver safe patient care in the event of a cyber attack. Now, in this alert, they outline that all staff, not just IT personnel, must be prepared. So, all hospital staff must be prepared to operate during a cyber emergency. For most hospitals, experiencing a cyber attack that adversely affects operations is not an if, but a when question, because hackers are very, very adept at finding new ways to intrude. Therefore, it's very difficult, if not impossible, for hospitals to rely solely on preventing attacks with cybersecurity. Now, some of the major steps that the Joint Commission outlines in this alert include, number 1, that hospitals need to be able to evaluate hazards vulnerability through their analyses, or HVA findings, as well as prioritize hospital services that must be kept operational and safe during an extended downtime. Number 2, the alert goes on and says that hospitals need to be able to form a downtime planning committee to develop preparedness actions and mitigations with representation from all stakeholders. Number 3, hospitals need to be able to develop and regularly update downtime plans, procedures, and resources. Number 4, hospitals need to be able to designate response teams They should be able to create an interdisciplinary team to mobilize during unanticipated downtime events. Number 5, hospitals should be able to train team leaders, their respective teams, and all staff on how to operate during downtimes, including specific incidents that would cause downtime to go into effect. Number 6, hospitals should be able to establish situational awareness with effective communication throughout the organization and with patients and families. And finally, number 7, the Joint Commission wraps it all up by saying, after an attack, to regroup and evaluate and make necessary improvements, take steps to recover and protect systems. Now, of course, the patient is central to these types of cyber attacks. So the Joint Commission says it really, really well, in my opinion. Quote, communicate with patients whose medical devices may be compromised by an attack, according to pre-developed protocols. Have IT security professionals available to help answer any questions on the policy and governance associated with medical devices. Be ready to engage with vendors or manufacturers of medical devices to understand vulnerabilities, risks, and appropriate protection and response measures. Proactively manage all media to communicate accurate information and counter misinformation. End quote. And now it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to get into some new billing updates that are a part of the National Coverage Determination 30.3.3 for acupuncture for chronic low back pain. Now, the effective dates of change here is for January 1, 2024, and the implementation dates are for January 2nd, 2024. Now, the affected providers include our physicians and, of course, other providers who are billing Medicare administrative contractors, their MACs, for acupuncture services that they provide to Medicare patients. So be sure and be mindful and make sure that your billing staff knows about these two things. Number 1, the updated frequency edits for acupuncture for chronic low back pain, as well as number 2, the relevant codes for acupuncture and dry needling services starting January 1st, 2024. So again, I wanted to stress the importance of this change request number 13288 because it simply revises how Medicare edits for frequency of chronic low back pain claims for acupuncture. Again, simply revises, right? And note, these are only edit revisions to better align with the policy's intent and not any changes being made to the National Coverage Determination 30.3.3 acupuncture policy itself. So the NCD indicates that since January 21 of 2020, Medicare covers up to 12 visits in 90 days for acupuncture for chronic lower back pain. And CMS defines chronic low back pain as something that lasts longer than 12 weeks. It's also supposed to be nonspecific in that it has no identifiable systemic cause, such as being associated with any metastatic or inflammatory or infectious disease. And it also can't be associated with any type of surgery. And it also cannot be associated with any type of pregnancy. Now, CMS covers another 8 sessions for patients demonstrating some sort of improvement. They will not cover more than 20 acupuncture treatments annually. Now, the HCPCS codes that are associated with these 4 acupuncture services for chronic lower back pain include the first HCPCS code is 97810, which is defined as acupuncture 1 or more needles without electrical stimulation, initial 15 minutes of personal one-on-one contact with the patient. And then the second HCPCS code that's associated with the acupuncture is an add-on code, which is add-on code 97811, which is defined as acupuncture 1 or more needles without electrical stimulation, each additional 15 minutes of personal one-on-one contact with the patient with reinsertion of needles. And of course, the fine print there says to list separately in addition to the code for the primary procedure, because like I said, this is an add-on code. And then third, that third HCPCS code for acupuncture is 97813, which is defined as acupuncture, one or more needles with electrical stimulation, initial 15 minutes of personal one-on-one contact with the patient. And then finally, the fourth acupuncture code is another add-on code 97814, which is defined as acupuncture, one or more needles with electrical stimulation, each additional 15 minutes of personal one-on-one contact with the patient with reinsertion of the needles. And again, the fine print again says list it separately in addition to the code for the primary procedure. And then be mindful that there are also two codes for dry needling, and they are number one, CPT code 20560, which is defined as needle insertions without injections, one or two muscles. And then the second CPT code is 20561, which is defined as needle insertions without injections, three or more muscles. Now, here's what's new for January 1, 2024, right? So effective for those claims with dates of service starting January 1st, 2024, CMS will count one session of acupuncture or dry needling like this. One initial acupuncture HCPCS code, either CPT code 97810 or 97813, with or without any variation of HCPCS acupuncture add-on codes 97811 or 97814 on the same date of service. And then, of course, those dry needling HCPCS codes, CPT codes, 20560 or 20561 on the same date of service, but not both. So again, what that means in a nutshell is that CMS is going to be disallowing dry needling CPT codes and acupuncture CPT codes on the same date of service. So you can only do one or the other, right? CMS will not be accepting dry needling HCPCS codes, CPT codes, 20560 and 20561 on the same date of service as those acupuncture 4 CPT codes that I stated, right? 97810, 97811, 97813, or 97814. So it's important to note also that your MAC will be denying claims they get starting January 1st, 2024 that don't contain acupuncture or dry needling CPT codes like I stated above. So your MAC will not be adjusting those claims that are already processed either unless you bring those claims to their attention. So be mindful and speak up. And finally, I focus Season 9 Spark on success. I want this 9th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for success in all we strive to do. So, in this week's inspiring quote in Spark is from Confucius. Success depends upon previous preparation, and without such preparation, there is sure to be failure. Absolutely true, right? I think this quote reminds us that we prepare for success. I think this quote reminds us that all our education and our experience help support the path to our success. This quote inspires us to relish our preparation. We should not expect quick success. This quote inspires us to keep adding and adding to our preparation. After all, the more we prepare, the more success can be found. I'm happy Confucius's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, in my final note today, you guys, I can't even believe the month of August is almost over. I've got one more episode to release next week, my final end of the month fraud, waste, and abuse, my very favorite episode. And that will be my last episode. I'm going to close out season 9, you guys, and the month of September starts up season 10, and it's going to be my 3rd year of podcasting. So just incredible timing and a bow I can tie very cleanly both at the season end as well as my year end. It just happened to work out that way. So I'm just very, very fortunate that I have such an amazing band of listeners that tune in across the world week after week for these past 2 years. So again, big shout outs to all of you. Thank you so much for all of your continued support wherever you are in the world tuning in to my podcast. And it just makes me so happy. I see you all tuning in from week to week, and I truly, truly am grateful and humbled, and I appreciate it so very much. And it is your support that allows me to continue on to my next year of podcasting. And I do have a lot of new things in store that I hopefully can share with you within the next couple of weeks, a brand new arm to my podcast. So it's going to be very, very exciting. New things are going to be happening for me in the weeks ahead. So I'm just really, again, grateful and humbled to all of you. And I hope you guys have had a great summer. I know I have. I know things are going to be wrapping up here very quickly. It's incredibly hot today in the 90s as I'm recording this episode, but I know in a matter of just 2 weeks, things are going to cool down here pretty quickly, and then we'll get up to an Indian summer in October. But regardless, it's a good time because the snow isn't falling yet. So I'm happy to enjoy whatever sunshine I do get. So anyways, you guys, I hope you all have time to have some last moments of fun in the sun as the summer will be quickly winding down here in the next couple of weeks. So I hope you're enjoying yourselves and finding time for yourselves. Self-care is important. Decompress. It's not all about work. It's about having fun and enjoying life while you have it. So embrace it. Thank you guys so much. Enjoy an amazing week ahead. All right. Thanks so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.